The Prime Minister, Dr. Rakana Rugunda, has launched the National HIV and AIDS Strategic Plan, which will run from the financial year 2020-2021 up to the end of the financial year 2024 to 2025. The plan is themed on leaving no one towards ending AIDS by 2030 and has been developed by Uganda AIDS Commission. The multi-sectoral stakeholder strategy is anchored on the National Development Plan 3 and other international and regional obligations such as Sustainable Development Goals, and it focuses more on primary HIV prevention and reaching adolescent girls and young boys. The Premier also launched the International Conference for AIDS and Sexuality in Africa, ICASA, which will be hosted in the country in December 2021. In light of the achievements made so far in the fight against HIV and AIDS, Dr. Rugunda commended President Yoweri Museveni for leading the country in the fight against this pandemic in 1986 by rallying all the stakeholders to create maximum advocacy to improving HIV awareness in communities.
In those early years, AIDS killed many Ugandans because of limited awareness and absence of life-saving and retroviral drugs to treat our people. As part of the NRM ideology, we established a health for all agenda, and so the Uganda AIDS Commission established by an act of parliament to coordinate the multi-sectoral HIV and AIDS response in the country. I must say that the Commission has done a commendable job.
The Premier also highlighted that Uganda has made tremendous progress in combating HIV and AIDS epidemic through a number of initiatives which have led to a reduction in the HIV prevalence rate from 18% in the early 1990s to 6% in 2019, and a reduction in the AIDS-related deaths from 60,000 to 22,000 in the last 10 years, among others. The Premier, however, noted that despite the success registered against the HIV and AIDS fight, the HIV prevalence remains high among women at 6.8% compared to that of men at 4.2%, while amongst the older adolescents and young people, the prevalence is almost 4 times higher than that of the females and the males. He also cited that the COVID-19 pandemic has immensely affected people infected with HIV/AIDS and pledged government's prioritization of HIV at the national agenda. The Dean of School of Public Health, Professor Rhoda Wanyenze, also highlighted on the impact of COVID-19 on HIV interventions, such as the disruption of supply chain and delivery during the lockdown, among others, while the chairperson of the National Forum of People Living with HIV/AIDS in Uganda, Dr. Stephen Watiti, appreciated the mechanisms government has put in place to help the people living with HIV and AIDS.
As people living with HIV, we appreciate the government of Uganda and other various stakeholders for the services rendered to us. We now have over 1.2 million Ugandans who are on ARV, and I'm one of them. For that, we are very grateful.
The forum was attended by a number of key stakeholders, including the chairperson and board members of Uganda AIDS Commission, the Director General of Uganda AIDS Commission, officials from UNAIDS and UN Women, among others. Doreen Nasasira reporting for UBC News.